Hello everyone and welcome back to MediInsights. Today we discuss Bisacodyl Suppository, a fast option for relieving constipation and for bowel preparation before procedures. In this video you will learn how it works, how to use it safely, common side effects and essential precautions to follow, and practical tips. Let's talk about the conditions this medicine helps treat. Bisacodyl suppository is used to relieve occasional constipation when other measures like fiber and fluids have not worked. It is a stimulant laxative given rectally to encourage a bowel movement fairly quickly. Healthcare providers also use it to empty the lower bowel before certain procedures or tests, such as a rectal exam or imaging that requires a cleared colon. Because it acts locally in the rectum and lower colon, a suppository can produce relief much faster than oral tablets. Suppositories are commonly chosen when rapid action is needed or when a person cannot take oral medication. They are suitable for adults and older children as advised by a doctor or a pharmacist. Bisacodyl suppositories are intended for short-term use, usually for a single dose or for a few days only, unless a doctor recommends longer treatment. They are not a long-term solution for chronic constipation and should not replace lifestyle measures like diet, hydration, and activity. People with severe abdominal pain, nausea, vomiting, or signs of bowel obstruction should not use stimulant laxatives and must seek medical care. If bowel movements do not improve or bleeding occurs, stop the suppository and contact a healthcare professional for further evaluation. Always follow the product instructions or a prescriber's advice. Here's how this medicine should be taken and how much to use. For adults and children aged 10 years and older, the usual dose of a bisacodyl suppository is one 10 mg suppository inserted into the rectum once a day as needed. Children aged 4 to 9 may be given a 5 mg suppository only on a doctor's advice. Do not use more than one suppository in a 24-hour period unless a health professional tells you to. Suppositories often work within 15 to 60 minutes, so expect a fairly rapid bowel movement after insertion. When used for bowel preparation before a procedure, your doctor or the hospital will give specific timing and dosing instructions to coordinate with other preparations. For ongoing constipation, treatment should be short-term, generally not exceeding a week without medical review. Longer use can increase the risk of dependence and may mask underlying problems. If you miss a dose, do not double up next time. Simply use one suppository when needed and follow product directions. Older adults may be more sensitive to laxatives, so start with the lowest effective dose and consult a healthcare provider if there are concerns. If you are uncertain about dosing for children, pregnancy, or medical conditions, ask a pharmacist or doctor before using a suppository. Let's talk about how this medicine affects your body or symptoms. Bisacodyl is a stimulant laxative that works locally in the rectum and colon to promote bowel movements. When inserted as a suppository, it directly contacts the rectal mucosa and stimulates enteric nerves to increase peristaltic activity. This stimulation causes rhythmic contractions of the colon muscles, which move stool toward the rectum for evacuation. Bisacodyl also has a local secretory effect, increasing fluid and salt secretion into the intestinal lumen, which helps soften the stool and ease passage. Because the action is largely local, systemic absorption is minimal and effects appear faster than with oral tablets. Onset after rectal administration is typically within 15 to 60 minutes, making suppositories useful when a prompt bowel movement is needed. The drug is converted to an active metabolite by local enzymes in the gut, which contributes to its stimulant effect. Repeated daily use can alter normal bowel function, so bisacodyl is intended for short-term relief rather than chronic management. The clinical effect depends on dose, formulation, and individual bowel sensitivity, so some people will respond more quickly than others. If you have inflammatory bowel disease or suspected bowel obstruction, the stimulant effects could be harmful. Therefore, avoid using bisacodyl in these situations unless directed by a clinician. As with any drug, there are possible side effects to watch for. Common side effects of bisacodyl suppositories include rectal irritation, a burning or stinging sensation during or after insertion, and abdominal cramps or cramping pain as the bowel begins to move. Some people experience loose stools or diarrhea if the effect is stronger than expected. With frequent or prolonged use, stimulant laxatives can cause electrolyte disturbances, dehydration, and changes in normal bowel rhythm. Less commonly, users may notice nausea, dizziness, or a general feeling of weakness if diarrhea is severe. Any passage of blood from the rectum, black or tarry stools, or severe abdominal pain should prompt immediate medical attention and stopping the suppository. Allergic reactions are rare, but wheezing, swelling of the face or throat, or hives require urgent care. Because suppositories act locally, systemic side effects are uncommon in short-term use. In breastfeeding people, bisacodyl is minimally absorbed and is generally considered acceptable. However, discuss any medication with your healthcare provider. If side effects persist or become bothersome, stop using the product and consult a pharmacist or doctor for alternative options. Avoid combining stimulant laxatives with other strong laxatives without medical advice, as this can increase the risk of adverse effects and dehydration. Stay hydrated and contact a doctor if you feel faint. Lastly, some important reminders and precautions. Before using a bisacodyl suppository, read the product leaflet and check the expiry date. Wash your hands and find a comfortable position, such as lying on your side with your knees drawn up or standing with one leg raised on a chair. Remove the wrapper and moisten the tip if needed to make insertion easier. Gently insert the suppository pointed end first into the rectum, pushing it in until it feels secure, and remain still for a few minutes to avoid premature expulsion. Do not attempt to break or crush suppositories unless a pediatric dose requires dividing them and a pharmacist has advised how to do so. Expect results within 15 to 60 minutes and plan time accordingly, especially when using a suppository before leaving home. Avoid using a suppository if you have unexplained rectal bleeding, severe abdominal pain, or known bowel obstruction, and seek prompt medical advice in those situations. Limit use to the shortest time necessary and avoid daily long-term use without a healthcare review to reduce the risk of dependence and electrolyte problems. Keep hydrated and maintain a diet with adequate fiber to reduce future constipation episodes. If you are pregnant, breastfeeding, or taking other medicines, check with a healthcare professional before using bisacodyl suppositories. Thanks for watching MediInsights. If this video helped you understand bisacodyl suppositories, please subscribe to our channel and leave a comment with your questions or experiences, and hit the bell to get notified about more clear, practical medication guides today.